Okay, so our thing today is Parvo treatments for dogs. Everybody's talking about how to keep them hydrated. You get a syringe, kind of like this one here. See how this one hasn't been opened. They'll take this and they'll use this to put fluids in the back of the dog's throat, or to maybe help the dog lap it up, or whatever that they do to try and keep the dog hydrated. If you can do it and they don't throw everything back up, then that's fine. But giving a dog fluids when they have parvo, one of the main things for parvo is diarrhea and vomiting. Whenever you put something in their stomach, you're inducing that vomiting. It gives them something to throw up, which makes it worse on the animal themselves. A vet friend of mine actually showed me how to do this and told me that it's actually kind of easy to get your hands on. An IV kit is what you give. Like when I was in the Army, that's what we would give soldiers when they were dehydrated or they were injured to keep their fluids in their systems. You would ask them for an IV bag. This one's a lactated ringer's bag. There are other types of IV bags that you can use, but for this situation, we're using this one. You would set it up like you would normally for a person.
Your vet will show you how to do it.
Your vet will show you how to do it when you ask them for it. If they don't show you, ask them to show you. They will install this piece here for you and show you how to do it. Whenever you're hooking your dog up with an IV, you don't have to find the vein for this to work. What you do is you find, like, see right here, we've already got the lump on the back of his shoulder blades from where we just finished giving him this. But what you do is you pinch his skin and you pull up, and it forms like a triangle right here, like a tent, like you're tenting their skin. And you look for the door of the tent with your finger. It's going to be the loose part that goes in between your fingers and his skin. That's the part where you want to take this needle and you want to stick the needle right there. Don't push hard. You don't have to put much force. Your dog's gonna jerk a little bit if he does at all. Don't be scared, you're not hurting him. Once you get it in there straight, just straight in, let go of the tent and let it lay there, and then you hold it flat. Then you would reach over here and you would unpinch your hose. Like I said, your vet, all you got to do is ask them to show you how to do this, and they will. You would unpinch this hose, roll it up, watch your dropper. You want to watch that and make sure it starts dripping. If it starts dripping at a normal pace, it looks like it's dripping kind of fast, that's fine. That's what you want. If it's not dripping at all, then when you laid the needle down, you either put it too close to his muscle tissue or his fat, and the needle's plugged off. All you got to do is pull back on it a little bit, not enough to pull it out, turn it, and as soon as that starts dripping again, then you're good to go. And then you're just going to sit there and you're going to wait. It'll fill this, see, I don't know if y'all can really see the knot or not, but this area right here is bubbled up.
That's normal.
And that's normal because you want that to bubble up. That means that the fluid is in his system, it's in there, and it's just going to naturally absorb down into his bloodstream and into his muscle tissues and everything and keep him hydrated.
It's an under the skin treatment.
And it keeps him from getting nauseous at the same time because there's nothing in his stomach to actually throw back up. He may gag every once in a while, but that's just the normal nausea kicking in. He smelled something made him dizzy, you know, like a normal person would. They're going to get dizzy, nauseous, they may gag a little bit. But this is the best way to do it, to keep your dog from spitting everything back out. It'll keep you from having to clean the messes up, and it'll keep him from being in pain while he's going through this process. You see, right now he's just sleeping. Sleeping nice and comfortably, and that's what you want. Whenever they're going through this sickness, you want them to sleep comfortably, be as still as possible on a hard, cold surface, because sometimes they'll have fevers along with this virus, and the cold surface will help keep that fever down, as well as keeping them hydrated. Thanks for watching. If you have any comments, just go ahead and leave them, post them.